So today I'm going to perform blood glucose monitoring for my patients. Before that, I'll read the scenario. After reading the scenario, I'll check that the scene is safe, free from spillages, called wire that will pose a threat to myself, patients, or others. After that, I'll perform my hand hygiene according to the WHO guidelines and adhering to the 5 movements of hand hygiene. I'll get a perfume of alcohol gel, rub my hand from palm to palm, back of my palm finger interlace, vice versa. Palm to palm finger interlace, back of my fingers finger interlocks, vice versa. Circular rubbing of my fingertips, vice versa. Rotational rubbing of my thumb, vice versa. And rotational rubbing of my wrist, vice versa. Now my hands are clean and dry. I'll attend to my patient in a calm and professional manner. Hello, my name is Priscilla and I'll be your attending nurse today. How do you prefer I call you?
You can call me Christine.
Christian, how are you doing today?
I'm good.
Are you warm enough?
Yes, I am.
Are you comfortable enough?
Yeah.
Can you see and hear me clearly?
Yeah.
So I'm going to check my patient identity, that's name, date of birth, hospital number. I'll provide privacy, explain procedure, and gain consent. So Christian, the reason why I'm here today is to perform your blood glucose prior to giving you your insulin injection. This medication is going to involve a needle. I'm going to use a small needle to prick your fingers. Do not worry, I'll be gentle as I can. Is that okay with you?
Yeah, that's okay.
Okay, Christian, do you remember the last time you have your meal?
Just this morning.
Okay, that's perfect. And are you able to wash your hands with soap and water?
Yeah.
Okay, that's also okay. So I'm going to arrange my things. Is it the right time for me to do it?
Yeah.
And are you happy for me to do it? Yeah. Okay, so I'm going to arrange my things. In case you need me, please do shout my name and I'll be here to address all your concern. Is that okay with you? So now I'm going to prepare my materials. Before that, I'll get a tray, clean, dry, that has been disinfected for the last 24 hours. Accessory, is it safe for me to use? Yeah. Then I'll get my sharp box, clean, dry, and has not overfilled past the warning light. I can close and open it 3/4 full before and after use. Quick hand job. I'll get my glucometer, clean, dry, that has been disinfected for the last 24 hours. Accessory, is it safe for me to use? I'll get my glucometer strips, clean, dry, that has not exceeded the expiring date of 2024. Is it safe for me to use? I'll get my gauze, clean, dry, intact, and natural setting have to come in a box with expiring date on it. Accessory, is it safe for me to use? All right. I'll get my lancet, clean, dry, intact, in natural setting have to come in the box with expiring date on it. Accessory, is it safe for me to use? Yeah. Okay. All right, I'll do a quick hand job. And I'm going to put on my apron and gloves. So now I'm going to go to my patient, minimizing disturbing the curtains as possible. So Christian, I'm back. Do you still want me to continue?
Yes, please.
Okay, so which hand do you want me to perform this procedure? Is it your right hand or your left one?
Left, please.
Okay, have you had any injury or surgery to these hands?
No.
Okay, can I assess it?
Yeah.
All right. So I can see that there's no fistula. There's no any signs of infection, and your hands is also clean, so it's safe for me to use. Okay. So now I'm going to take my glucometer strips, open it. The wrapper will go to the domestic waste bin later, and I'll insert it to the glucometer. Okay. I'll take my gauze and place it in my non-dominant hand and take my lancet. And I'm going to open it. This will go to the domestic waste bin later. I'm going to prick my patient's finger, avoiding the thumb and the index finger. So Christian, I'm now going to prick you. Is that okay with you?
Yeah.
So 1, 2, 3 sharp scratches coming. This will go to my sharp box. And I'm going to make sure that all the windows is filled with the blood. I'm going to place the gauze on it to stop the bleeding. And this will go to the clinical waste bin later. Glucose is 9 millimole per liter. So there is a bit high. The actual blood glucose level is 4 to 7. So with this, I'm going to give you your insulin. Is that okay with you?
Yeah.
Okay. Okay, so before that, can you cut on your sugary in food intake? Is that okay with you?
Yeah.
Okay, is there any question you want me to address?
No, all right.
All right, so I'm going to do my aftercare in the other room. In case you need me, please shout my name and I'll be here to address all your concerns. Is that okay with you?
Yeah.
So I'm going to do my aftercare. Everything that touches the patient, including my apron and gloves, will go to the clinical waste bin, and the wrappers will go to the domestic waste bin. I'm going to remove my glove and do my documentation, one at a time. A quick hand job. So I'm going to close my sharp box, 3/4, and I'm going to disinfect my trolley and place it in the rightful position and the sharp box in the rightful position, and I'm going to do my aftercare. Thank you.